I'm Lauren St. Germain here at DeSoto Memorial Hospital. We are getting a first-hand look at training for EMS agencies and nurses, specifically in rural counties. The goal is to make sure they're better prepared to handle obstetric emergencies. Farmland, green space, and far away from the hustle and bustle of the big Florida cities. We met Captain John Haney and his family in DeSoto County. You have two very personal experiences that really highlight the need for this kind of training right now.
Yes. One, I am a firefighter paramedic, and I have assisted and conducted field deliveries. And two, more personally, both my daughter and my youngest son here were born outside of the hospital.
His daughter was born at home, not on purpose.
The rescue crew came in and we delivered my daughter right there on the couch.
His son was born in the back of the DeSoto County Fire Rescue Unit.
Okay, so come on into our setting.
Inside DeSoto Memorial Hospital, Captain Haney is one of several medical professionals from EMS agencies to hospital staff learning how to best handle maternal and newborn emergencies. Colleen Reiner is with the USF Health Center for Advanced Medical Learning and Simulation, or CAMLS. It's one of the programs putting on the training.
In a lot of the rural communities in the state, there might not be a labor and delivery unit that's readily available. So that makes it a little bit challenging for mothers, because even if you have the best laid plans that you're going to, travel to go to a hospital with a labor and delivery unit, sometimes life has different plans, and when that baby's coming, the baby's coming.
The Florida Perinatal Quality Collaborative works with maternity hospitals, and over the years we've noticed that there are fewer maternity hospitals than there used to be.
I also spoke with Lori Reeves. She's the executive director of the Florida Perinatal Quality Collaborative, another program bringing this training to fruition.
Every time a hospital closes a maternity unit or the whole hospital closes, sometimes another hospital will open in the state. But what we're seeing is they're not opening in those rural communities. And so over time, the hospitals that provide maternity services have kind of shifted to the more urban areas of the state and left the rural areas with fewer maternity resources.
Reeves gave us this map the FPQC put together. It shows urban and rural counties in the state, and the current maternity hospitals are labeled with these blue pins. You can see many women living in these rural counties, which are in green, have to drive long distances to get to a maternity hospital.
What we know is that if you live 45 minutes or 50 minutes or more from a hospital with maternity facilities and you have an emergency, you may not always be able to get to that hospital first.
And from your house to Advent Sebring, where your wife was going, how many miles?
45 minutes. It's 28 miles, I think it is.
But about 45
about
minutes.
45 minutes.
And so the effort of this project, working with our partners, is to make sure that if they call 911 or they go to one of these small hospitals, those sites and teams are equipped.
Having a more in-depth knowledge of how to deal with OB emergencies is really crucial whenever you can't just have a 5-minute transport.
The training also includes information about referring patients to Florida's telehealth maternity care program to get more prenatal and postpartum services for women, all with the end goal of getting women in the state the care they need no matter where they live.